Type 2 diabetes is a condition that causes the level of glucose or sugar in the blood to become higher than normal. Type 2 diabetes is primarily the result of two interrelated problems. Cells in the muscle, fat, and the liver become resistant to insulin. Because these cells don't interact in a normal way with insulin, they don't take in enough sugar. And two, the pancreas is unable to produce enough insulin to manage the blood sugar levels. Biotin may improve the glucose and the triglyceride level in people with type 2 diabetes and reduce pain from diabetic nerve damage. Biotin is a B vitamin needed to activate a major enzyme that's involved in glucose metabolism. Chromium piclinate specifically has been shown to reduce insulin resistance and to help to reduce the risk of cardiovascular disease and type 2 diabetes. Dietary chromium is poorly absorbed, and chromium levels decrease with age. A new study from Deakin University has found that taking 500 milligrams of vitamin C twice a day can help those with type 2 diabetes by lowering the elevated blood sugar levels across the day and by minimizing spikes in blood sugar after meals. The best form of vitamin C is liposomal vitamin C, then a non-acidic buffered form, with the worst kind being cheap acidic ascorbic acid. Adults with type 2 diabetes and lower levels of B12 could be more likely to experience cardiovascular autonomic neuropathy. This is according to new findings. The cardiovascular autonomic neuropathy occurs when nerve damage affects the heart. This can be caused by prolonged hyperglycemia over several years in people with diabetes. It's important to realize that a B12 blood test may not detect a B12 deficiency, as food is now fortified with folate, and this can give a false reading on the test. Apart from B12 injections, the next best form is a sublingual methylcobalamin 5,000 microgram per day dose. Research has shown that berberine can help with high cholesterol, high blood pressure, polycystic ovary syndrome, and skin issues like burns and canker sores. It's also been shown to help people with type 2 diabetes because it appears to help to regulate blood sugar, just like the drug metformin, but with less side effects. Typical doses are 500 milligrams 3 times per day in the form of berberine hydrochloride. See my other video on life extension and my video on the anabolic triad for more potential benefits from berberine. The results of a study demonstrate that an intake of 1, 3, or 6 grams of cinnamon per day reduced the serum glucose, the triglyceride, the LDL cholesterol, and total cholesterol in people with type 2 diabetes, and it suggests the inclusion of cinnamon in the diet for people with diabetes to reduce the risk factors. While most of the research on alpha-lipoic acid in diabetes has focused on its effects on neuropathy, several clinical trials have now found that the alpha-lipoic acid may increase insulin sensitivity and help to reduce blood sugar and lipids, largely through improved measures of oxidative stress and inflammation. Typical doses are 600 milligrams 2 to 3 times per day with meals. In one study, 50 female participants with type 2 diabetes received either a 1 gram dose of royal jelly or a placebo once a day for 8 weeks. The results indicated that taking royal jelly can lead to a reduction in the level of blood glucose. There's some evidence that high doses of vanadium sulfate, 100 milligrams a day, provide 31 milligrams of elemental vanadium, and this can improve the way that people with type 2 diabetes use their insulin. Randomized controlled clinical trials have demonstrated that supplementation with CoQ10 can significantly improve the glycemic control, as well as improving vascular dysfunction. Supplementation with CoQ10 may be of particular importance in type 2 diabetics who are prescribed statins and in those with fatty liver disease. Doses can be from 300 to 500 milligrams per day. Coenzyme Q10 works better when it's taken with 40 milligrams of PQQ per day. See my other video on mitochondrial boosters for more ways to help mitochondrial function. Vitamin D supplementation can help to lower average blood sugar levels in people with type 2 diabetes, and this is especially effective in people who also have a vitamin D deficiency and are non-obese and deficient. You can get a 25-hydroxy vitamin D blood test and then supplement accordingly with vitamin D3. It's estimated that 1 in 2 people with type 2 diabetes have sleep problems due to the unstable blood sugar levels that accompany the diabetes-related symptoms. High blood sugar, or hyperglycemia, and low blood sugar, hypoglycemia, during the night can lead to insomnia and next-day fatigue. See my other videos on herbs for sleep and my video on melatonin for more possible remedies here. People with type 2 diabetes should undertake at least 150 minutes per week of moderate to vigorous aerobic exercise spread out during at least 3 days during the week, with no more than 2 consecutive days between the bouts of the aerobic exercise. A gentle 20 to 30 minute walk after a meal can help to reduce a blood sugar spike naturally. An intervention involving fibre supplementation for type 2 diabetics can reduce the fasting blood glucose and the HbA1c. This suggests that increasing dietary fibre in the diet of patients with type 2 diabetes is beneficial, and it should be encouraged as a disease management strategy. Magnesium helps to regulate blood sugar, and it has many benefits. Yet a magnesium deficiency is often seen in people with diabetes. A deficiency can occur with type 1 and type 2 diabetes, but it appears to be more prevalent with type 2. This is because low levels of magnesium are associated with insulin resistance. The best form of magnesium is magnesium bisglycinate. In order to determine your dose, slowly increase until side effects like stomach discomfort or diarrhea are noticed. Then slowly decrease the dose until you find your maximum tolerable daily amount. As magnesium is required for the proper functioning of hundreds of enzymes, it can have profound benefits to the health when taken for a few months. Another supplement that's needed by many enzymes and may work synergistically here is zinc. This is usually taken in the form of zinc picolinate. Some studies have shown that zinc improves the glucose levels, the glycemic control, in people with diabetes. You should have a low glycemic diet. This is based on the concept of the glycemic index. Studies have shown that low glycemic index food can result in weight loss, reduce blood sugar levels, and lower the risk of heart disease and type 2 diabetes. Other recommendations are low lectin and gluten-free diets. Despite marketing, different studies done by reputable researchers reveal that those who drank light sodas actually increased their risk of contracting type 2 diabetes. The odds of acquiring diabetes for diet drinkers are actually higher than those who drank regular sugary soda. These results are found to be consistent even when measured on an equal serving basis. And what's even more bothersome is that there's a craving effect associated with these drinks. Studies have shown that those who consume products made with artificial sweeteners, such as aspartame, have a higher affinity for sugar. That is, those who are exposed to higher amounts of aspartame can actually crave more sugary items, leading to binges that can further increase the risk of contracting diabetes and other health complications, such as memory impairment and early onset dementia. And last but not least, even though aspartame doesn't contain any sugar, it has some physiological effects similar to sugar, thus increasing blood sugar levels and eventually increasing insulin levels. It's this sudden increase in the insulin production that leads to the desensitization of the insulin, which is the main symptom of type 2 diabetes. For more information about the herbs or supplements mentioned in this presentation, check out my website. And for information on diabetic neuropathy or diabetic retinopathy, also see my website.